How's it? This is Hoala Greavy, founder of Paubox, and we're here with you for another month's installment of HIPAA Center. I'm very pleased to have Leolinda Parlin, CEO of Hilopa'a Family to Family, all the way from Oahu. We're here in San Francisco. She's up here for a conference. We figure, hey, great, let's go do a HIPAA Center. So Leo, thanks for joining us.
Oh, thank you for having us.
Right on. Can you tell me more about what your company does?
Yeah, I'd love to. So Hilopa'a Family to Family is an organization where we actually broker information. So we take calls on a daily basis of people who have concerns or frustrations about accessing healthcare in Hawaii. So they may have issues with their health plan, they may have issues with their providers, or they just may not know how to navigate the system. So we provide the information, support, and referrals to get them to the right front door.
Wow. And you know, considering how discombobulated healthcare is nationwide, I can imagine your phones are just ringing off the hook.
Yeah, we do get a lot of calls, and so that requires us to communicate a lot with our health plans in Hawaii, office physician practices, the community agencies, and so we spend a lot of time just getting people connected, translating issues and concerns into healthcare ease, because that's not something that typical families, especially individuals with disabilities and special healthcare needs, come with that playbook.
And speaking of secure communications, how are you folks doing that currently?
Oh, right now we are a Paubox happy customer. Primarily, most of our communication is email because it's so much easier and faster for us to be able to get to the right person to talk to, get them a secured message about the patient that has concerns, and then get a prompt reply back.
Yeah, because gosh, you know what? Every American in this day, they got a phone and they got an email. And if you're trying to get them to download an app or change their behavior to communicate with you, that's tough.
Right, and and many of our government programs are phone dominant, so they're busy taking calls. So we don't want to get stuck in the queue. In fact, one of the reasons why people call us is because they can't get through their phone queue. So we're able to send an email with encrypted information and get a response back faster than someone who's actually trying to crawl into that program to get the same kind of information.
Lovely. So, Leo, what was life like before Paubox?
Oh my goodness. It was so bad I didn't even know it. We had another, he who shall remain nameless, vendor for encrypted email, but it required us to make a decision for each email, how we were going to send it, hit another button, it would go out, it wouldn't even store the email in our outbox, so we had to go to the web if we wanted to retrieve a message to kind of watch the thread. We just assumed that was the industry standard, and it was what it was, so we put up with the frustration. Unfortunately, because you had to go through all this decision making, there were times that email left our office that hadn't been encrypted. It went as registered because they were multifunction you could have done with the email. So probably not the best thing to have, but at the time it was all we could have our hands on. When we switched over to Paubox, it just made so much more sense, and I felt wonderfully excited about using the technology, but I also felt terribly sad at the same time because all the staff had emailed me, thank you so much. They were so relieved that we had made that transition. I had no idea at all how cumbersome the multi-step process of the old platform was, let alone the anxiety of always worrying about when that you hit the right button to make sure it was encrypted, or even the amount of language that was required to retrieve the message to watch the thread to go through. With Paubox, it's absolutely seamless. Life is good, staff is happy, happy staff, happy life, so I'm very pleased with Paubox.
Wonderful. So, okay, government programs.
Yeah.
Can you tell us more about the work you're doing with the Hawaii State Department of Health?
Yeah, sure. So we do provide a lot of support to the health department. There's a couple of projects that we're supporting them in, primarily in some quality management and monitoring. So we'll go out and do surveys on quality improvement, on quality of life surveys for individuals with developmental disabilities. We also assist the state in scheduling interviews and assessments for individuals. So in that regard, we're again having to take this private information, communicate, schedule appointments, get things going, and we use Paubox to be able to get that information out.
Man, that's wonderful. It's God's work you guys are doing.
Oh, thank you.
Need that.
Yeah, I think we fill a niche that's important, that's missing, and within our organization, many of our staff are parents of children with special health care needs.
Yep.
Or professionals themselves that have been working in the field for a long time. So, we're just kind of connecting and we're bridging between the government programs and the community.
So I learned last night you are a gold member for the Marriott and Hawaiian Air.
Yes.
That sounds to me like you travel a bunch. Can you tell me the nature of this travel, and are there other organizations you're especially reaching out and touching?
Sure. We do a lot of neighbor island support. We'll go to the neighbor islands, do a lot of training. We do, training, facilitation, again, sitting with folks to come together to kind of bridge with communication. In this last couple of years, we've supported about 75 community pediatricians from Oahu to the Big Island to Maui, in helping them in their quality improvement and healthcare transformation needs. We also do training with many community organizations, bring them together to meet each other face to face for the first time, and train together as a community, so that if they can build their relationships, they can better serve the people that they serve, because they'll have connections into the sister agency. It's not unusual for us to hear about folks that have been working for 15 years and have only spoken to someone on the phone but have never met face to face.
And this is in Hawaii.
This is in Hawaii.
A really small state.
In a very small state.
Standards of the other 49 states.
Right.
Wow.
So we kind of, so that's one of our strategies, is to actually bring people together.
So is Kahuliao one of those organizations you're working with?
Yeah, so Kahuliao is an activity of the American Academy of Pediatrics, of the Hawaii chapter. And Kahuliao has brought together many of our mom and pop community pediatricians. So they're solo practitioners, working alone, with a staff of 3 or 4, just trying to stay on top of all the changes that are coming down, as well as providing good quality care to their children and their families that they serve.
And is this a lot of rural doctors, or just
They're all over.
Okay.
They're all over. So, they range, from, servicing families in Puna, their Hilo offices. We got, one doc in Hilo that, hops in his car and, will drive for an hour to go provide support to, a child who's medically fragile that really, because of their immune system is being compromised. He'll go do a home visit, or, one of our docs in Kealakekua, who's been there forever, and checks in on the coffee farm first before he comes into the office, as well as our docs in urban Honolulu.
Wonderful. So Leo, your staff is on the road tons, visiting people that you service. What's it like communicating with them securely in a HIPAA compliant manner using your smartphones?
Yeah, no, it's amazing. That was a feature that we never thought we could ever be able to do. So we can be incredibly responsive. We'll get an email. Maybe someone will have our email address, or they'll go through our website, initiate a quick inquiry. Wherever the staff is, they are able to respond immediately, and it's secured straight from their telephones, whether they're at the airport, where they're sitting in a room getting ready to do a training, whatever the case may be. We're able to respond immediately, and that's a feature that we've never could ever dream that could occur.
Man, that's great. I've read 50, if not 60 or 70% of all email now is read on mobile.
Yeah.
So it's a huge number.
Yeah, and and even beyond the PHI, sometimes we have to just transmit financial information. For example, just yesterday while I was here, off island, we had to book reservations for a training venue. So I felt very confident sending my credit card information through the encrypted email to be able to actually get it to the vendor, which actually made me feel good, because I felt more confident in my credit card information being transmitted than actually using the fax machine at the hotel. Like, who knows what kind of security is at the fax machine?
Yeah, exactly. And a lot of these things have hard drives in them that make copies of things being scanned or faxed, and
exactly.
Is it stored on that hard drive? How do they dispose of the hard drive?
Right.
a litany of unknowns on that.
Right. So I just think it just makes us more responsive, to everyone that we serve, as well as, people that were asking for help, like this event planning situation. We really had to commit to getting the room, getting it taken care of, and the last thing they needed was a deposit, and I wasn't on island, so Paubox to the rescue.
Yeah. Wow. That's so cool.
Yeah.
That's so cool. Oh man, thank you.
Yeah.
This is neat. Can you tell me more about Family Voices? I saw that listed on your site.
Yeah, so Family Voices was started about 20 years ago as an advocacy organization for families of children with special healthcare needs. And it was really part of the healthcare reform that came out of the Clinton administration that kids and families weren't at the table. The major, large, industrial, insurance companies, health plans were there, but there was really nobody representing kids and families with special needs. So 3 Tiger moms got together, one from Hawaii, one from New Mexico, and one from Iowa, to actually put forth this organization where they were able to, in no time, assemble a hui, or a group of parents in all 50 states, to actually create an agenda for kids and for families. And so, so Family Voices is very part of our history of advocacy, not only nationally, but also in the state of Hawaii.
Wow. And PMAG, did I say that right? PMAG?
Yes.
I also saw that on your site. Can you tell me more about that?
Right. So PMAG is probably the largest physician organization in Hawaii. Mm-hmm. It's comprised of about 900, physicians in the community, cross specialties, as an organization, as a membership organization, who are really looking out again for the physician's best interests in this type of healthcare reform.
So, if I understand you correctly, Hilopa'a Family to Family is providing assistance for a fragmented and largely broken system, largely focused in Hawaii, helping out people who may not have a voice traditionally.
Right.
Oh man.
Yeah. So
that's
not
fantastic.
only, thank you. It's good work. Not only are we helping the families directly, we're helping their providers, right? So whether it's through providing support and care coordination, mm-hmm. whether it's providing that direct service for assistance, resolving issues, we just want to provide the infrastructure. One of our mentors talks about that the work that we do is the space between the silos. Mm. And that's what we're trying to do, is kind of bridge the space between the silos.
Man, I can see no end of business opportunities in that space.
We keep saying we want to work our way out of a job, but I agree. I don't think that's going to happen for a while.
Yeah, wonderful. So, Leo, in HIPAA, there's a bit of a gray area regarding the use of calendars and calendar invites, and whether that triggers PHI and HIPAA regulations or not. How are you guys addressing that?
Yeah, so it's a good question, because we use the calendaring function a lot. We schedule appointments with individuals, so we've got to not only have their name, we might be sending somebody else out for an appointment, so we actually got address information for a patient or a participant in a health department program. Now, using and integrating in with Office 365, we'll schedule everything in our calendar, but when we invite the participant as a confirmation, it gets encrypted in Paubox, and that email actually goes out to that individual. And that's something that, again, we never thought we would be able to do. Our workaround was cumbersome. We would actually create the event in the calendar, print it out to a PDF, attach it to the email, and then send it out. It was a multi-step process. And then do it multiple times for the reminder. But this way, by just going through the calendar and using the functions, the reminders are automatic, and it's transmitted through Paubox, and it's encryption, so we don't have to worry about somebody getting information that they shouldn't.
Man, that's so great to know. We hadn't heard any customers say that to us, so thank you for sharing. That's any time we can save on productivity is more time you can commit to your business.
Exactly, and feel comfortable about it. Feeling really good about we're not on the edge. We're not pushing the boundaries of confidentiality. In fact, we're going above and beyond and protecting it.
Lovely. Okay, lightning round.
Yeah. Okay.
All right.
Ready.
Ready? We're going to ask a series of quick questions.
Okay.
Favorite Hawaiian food?
Opihi.
Oh, wonderful. Who would win in the octagon? A polar bear or a silverback gorilla?
I'm going with the polar bear.
Team polar bear.
Hey.
Oh yeah, naturally. Your last Halloween costume?
You know, I'm thinking it had to be Little Red Riding Hood.
Little Red Riding Hood?
Yeah.
Did you have like the wolves and like the whole assembly, or just the?
No.
You know how some people do like
Right,
Star
the whole
Wars
team
and
thing.
Han Solo, Princess Leia?
I will say that in 1982, we were all in the ohana, but that's a little before your time. And we had the whole ohana.
Got it. Favorite karaoke jam?
Oh.
Go-to.
My go-to favorite karaoke jam has to be Desperado.
Desperado. Who sings it?
Eagles.
Oh, I gotta go look it up.
Before your time.
Gotta go look it up. How many times have you seen the movie Big Lebowski?
Once.
Okay, rookie numbers. We'll get them up.
Yeah, but I think my son in double digits.
Yeah. That sounds about right.
So we can do what's a family collective number?
Average.
Yeah.
What book are you reading now?
Menopause Confidential.
Menopause Confidential. Is that a New York Times bestseller?
Well, I'm not sure. Heard it on a podcast and figured, well, I should know a few more things.
And last one. When's the last time you sent a fax?
Oh my gosh, the last time I sent a fax, I actually can't remember. I'm thinking it was probably in the last 2 years, and it probably had to go to a government program.
Wow. Being in healthcare and you can't remember the last time you sent a fax, that's a rare and great sign.
Yeah, we avoid sending faxes at all costs.
Yeah.
Between digital signatures, being able to use our Paubox for encryption, there isn't anything I can't transmit. If I can take a picture of it, I can send it.
Yeah.
And so, goodbye fax machine.
Wonderful. Well, thank you, Leo, for joining us today.
Right.
And this is Hoala from Paubox, and look forward to joining us next month for another installment of HIPAA Center. Aloha.
Aloha.